Welcome to St. Elizabeth Healthcare, and thank you for choosing our team for your orthopedic surgery. Spine surgery is considered an elective surgery, and therefore we have the luxury of being able to help you plan beforehand and provide you with all the information you need to know to have a successful surgical outcome. The goal of this education is to teach you how to properly prepare yourself, your home, and your partners in care for your surgery. We want to ensure that you fully understand what to expect through all phases of spine surgery.
To ensure your safety, you will be required to complete the pre-admission testing process no later than 7 to 10 days prior to surgery. As a part of this process, a complete health history will be obtained, as well as the completion of testing ordered by your surgeon. This appointment may be completed remotely via telephone or in person, based on your current health status and physician preference. At this appointment, you should be prepared to provide a listing of any medication you are taking. This includes any prescriptions, over-the-counter medications, vitamins, and supplements. If easier, for in-person appointments, you can bring your medications with you in a Ziploc bag for review. The nurse will advise you regarding the medications you should continue taking, what medications to stop, and when to stop those medications. It is very important that you follow these instructions. Medications not appropriately discontinued have the potential to cause your surgery to be canceled or delayed. The pre-admission process typically takes about 1 hour to complete. If you see a specialist for other conditions, for example, a cardiologist, your surgeon may ask you to visit that provider as well to obtain their clearance for surgery. It is important to note that if you have had any recent dental infections, you should notify your surgeon for direction. It is also advised that you provide a listing of anything that you are allergic to, whether food or medication, during the pre-admission testing discussion. About spine surgery. Your spine is a strong yet flexible column of bones that support your body, protects your spinal cord, and allows you to move freely. It starts at the base of your skull and extends down to your tailbone, forming the central structure of your musculoskeletal system. The spine helps you sit, stand, walk, twist, and bend. The spine is made up of 33 vertebrae, which are grouped into 5 regions. Cervical spine, neck, 7 vertebrae, C1 through C7, that support your head and allow for turning, tilting, and nodding. Thoracic spine, upper back, 12 vertebrae, T1 through T12, that connect to your ribs and provide stability. Lumbar spine, lower back, 5 vertebrae, L1 through L5, that bear most of your body's weight and allow for bending and lifting. Sacrum, 5 fused vertebrae, S1 through S5, that connect your spine to your pelvis. Coccyx, tailbone, 4 fused vertebrae that provide attachment for muscles and ligaments. Between each vertebrae is a disc, which acts as a cushion and shock absorber. These discs have a soft center and a tough outer ring. When a disc becomes damaged or herniated, it can press on nearby nerves, causing pain, numbness, or weakness. Spine surgery may be recommended to relieve nerve compression, stabilize the spine, or remove damaged tissue. Common procedures include discectomy, removal of herniated disc material pressing on a nerve. Laminectomy, removal of part of the vertebrae. Lamina, to relieve pressure on the spinal cord or nerves. Spinal fusion, joining 2 or more vertebrae to prevent movement and provide long-term stability, often using bone grafts and hardware. These procedures may be performed on the cervical, thoracic, or lumbar spine, depending on your condition. Your surgeon will explain the specific procedure and location based on your diagnosis and imaging results. Exercise, mindset. While surgery is an important step toward relief, your mindset and physical condition going into surgery can significantly impact your recovery. Patients who approach surgery with a positive attitude and a commitment to healing often experience better outcomes in the days and weeks leading up to surgery. Staying active is one of the best things you can do. Gentle walking helps maintain circulation and endurance. Ankle pumps, flexing your foot up and down like pressing a gas pedal, are especially important for preventing blood clots and keeping your legs strong. Pelvic tilts and other core engagement exercises can help support your spine and improve postural stability, which is critical after surgery. If you're unsure about which exercises are safe, ask your surgeon or physical therapist for guidance. Avoid any movements that cause pain, strain, or discomfort. The goal is to maintain mobility and strength without aggravating your condition. Nutrition, diet. Maintaining a healthy diet is important for your body prior to surgery and for your recovery from surgery. Your body's muscles and bones require good nutrition to heal. The following nutritional tips are recommended. Vitamin D supplementation is imperative for bone healing after spine surgery. Begin taking a vitamin D supplement now and continue as directed by your surgeon to support recovery and reduce complications. High-protein consumption is vital to rebuilding muscle after surgery. High-protein foods, such as meat, fish, and dairy consumed in the weeks prior to surgery, can provide essential fuel to the body to support the healing process and prevent infections. Vitamin C can help with inflammation as well as with the absorption of iron, which also promotes wound healing. Foods high in vitamin C include broccoli, tomatoes, citrus fruits, and kiwi, amongst others. Increased fiber intake is important to combat constipation, which is a known side effect of pain medication. Stay hydrated. Patients who are well hydrated, excluding in the 2 hours immediately preceding surgery, can have less pain and have been known to do better after surgery. Patients who are dehydrated may experience post-operative complications. Finally, have a plan for your meals after surgery. Perhaps have nutrition shakes on hand or prepare some meals ahead of time and have them ready to go in the refrigerator or freezer. Your body will need good nutrition to promote healing.
Get your home ready. Setting up your home ahead of time can make recovery safer and more comfortable. Here's what to do before surgery.
Most patients will be discharged the same day to their home. This is generally the safest place for you to go and where you'll have the best outcome. In order to best prepare your home, the following steps should be taken. Clean and organize your home. A tidy space reduces stress and lowers the risk of infection. You won't want to worry about cleaning during your recovery, so take care of it ahead of time. If you have pets at home, it's important to plan ahead. When you first arrive home, make sure your pets are in another room until you are safely inside and seated. After surgery, your balance may be affected, and sudden movements like a pet jumping on you or running underfoot can increase your risk of falling. Avoid bending or twisting to pick up pets, and do not allow them to climb into your lap or onto furniture with you. Keep your incision covered and minimize contact with pet fur or saliva to reduce the risk of infection. With a little precaution, your pets can still be a source of comfort. Just be sure to prioritize safety during your recovery. Choose the right chair. You will want to use a sturdy chair with 2 arms to help you stand up safely. Rocking chairs, low or overstuffed chairs, and sofas should be avoided. It is best to have a plan and have your space set up prior to your surgery with frequently used items where they can be easily reached. Make sure your home is well lit, especially at night. Consider placing nightlights in hallways or keeping a flashlight nearby for nighttime trips to the bathroom. Rearrange your kitchen. Move commonly used items to a location where you can reach them without bending, lifting, twisting, or pulling. Consider using disposable plates, cups, and utensils to avoid washing dishes during your recovery. Remove all throw rugs and items from the room that present a potential fall hazard. Things like coffee tables, plants, baskets, pet toys, etc. Install a handrail anywhere you have 3 or more steps. Install a safety bar anywhere in your home where it might be awkward to maneuver. These are not just for the bathroom. It is advised that patients stay away from those which adhere via suction cups, as they will not hold your weight and are generally unreliable.
Establish a partner in care. Having support after surgery is essential. Let's talk about why a partner in care is so important and what their role will be.
It is important that you have a designated partner in care who is an adult 18 years or older. This individual should accompany you on the day of surgery, and remain on-site and available for contact throughout your surgery. It is recommended that they bring their cell phone so we can contact them throughout the surgery experience. He or she is encouraged to be present when the RN reviews your discharge instructions in order to assist with any questions you may have later. They should stay with you the first 24 hours after surgery and assist in the coming days. It is recommended that you have assistance for 5 to 7 days after your surgery. If you don't have close family or friends in the area, at least have a neighbor check on you a couple times a day. The longer you can get assistance with things like dishes, laundry, garbage, and pets, the better it will be for you so you can focus on your recovery and getting your strength back.
The day before surgery. The day before surgery is an important time to prepare, both physically and mentally. Next, we'll go through what you need to do to ensure you're ready for a smooth procedure and recovery.
It's normal to have anxiety and be apprehensive prior to surgery. There are several things you should do to prepare the day prior to surgery, including notify your surgeon's office if you have any symptoms of an infection. This includes respiratory issues like coughing or a stuffy nose, urinary symptoms, fever, vomiting, diarrhea, rash on your back or abdomen, or any lingering signs of illness. Even mild symptoms can increase your risk of complications, so it's important to speak up. Take a full bath or shower and wash with Hibiclens as instructed. This should include washing your hair to reduce your risk of developing an infection after surgery. We recommend drinking 1 bottle of Ensure nutrition drink, Glucerna for diabetics, before going to bed the night before surgery. This can help you feel less hungry in the time frame when you're not able to eat prior to surgery. It has also been shown to help with recovery after surgery. Do not eat anything after midnight. Do not smoke or chew tobacco or use recreational drugs. Smoking increases the risk of complication and can hinder a patient's recovery. It is recommended that you stop smoking 4 to 6 weeks prior to your surgery. Avoid all alcoholic beverages for 24 hours prior to surgery. Follow medication instructions as directed by pre-admission testing. Try to get a good night's sleep and be well rested for your surgery.